Hi, good evening, everybody. We're going to get started. I am Danielle Green, Executive Director of State and Local Health Initiatives here at the CUNY School of Public Health and Health Policy. And I am thrilled to welcome you here tonight on behalf of the school's Sexual and Reproductive Justice Hub. We are excited to have so many RJ advocates, supporters, government representatives, and of course, CUNY SPH faculty, staff, and students in the room with us here in Harlem, New York, and joining us on the live stream. And we're particularly grateful for the support of our Dean, Ayman El-Mohandes, who is here in the room with us as well. We all know this is a challenging time, and we are excited to host this reproductive justice conversation, which at its core is about all women being able to control their bodies and therefore their lives. We are here tonight to talk about the impact of the national election on SRJ and strategic solutions to move forward with determination, resilience, vision, and kindness for ourselves and each other. To lead us through this conversation, we are joined by an incredible panel of RJ advocates who we will introduce shortly. We encourage you to submit questions for our moderator to ask our panelists. Volunteers are passing out note cards and pens. Please write your questions down at any time during tonight's conversation and hold your card up. We'll collect it and pass it on to our moderator. Live stream participants, please use the QA function on the Zoom and we will capture your questions as well. I have the pleasure of introducing Abigail Disney, who will moderate tonight's panel. As a philanthropist and social activist, she has worked with organizations supporting peace building, gender justice, and systemic cultural change. She is a documentary filmmaker who won an Emmy for The Armor of Light. Her latest film, The American Dream and Other Fairy Tales, which she co-directed with Kathleen Hughes, made its world premiere at the Sundance Film Festival. She also created the nonprofit Peace is Loud, which uses storytelling to advance social movements, and the Daphne Foundation, which supports organizations working for a more equitable, fair, and peaceful New York City. Abigail has been an ardent supporter of the SRJ Hub's Billy Avery Professorship Endowment, which honors the reproductive justice trailblazer Billy Avery with the nation's first endowed professorship in sexual and reproductive justice. You can learn more about the endowment campaign from the card you received that's on your chair. Before I pass it over to Abigail and our panelists, we have a special message to share with all of you from a big supporter of CUNY SPH's SRJ Hub. Under her administration, New York passed a constitutional amendment to protect against unequal treatment that includes pregnancy and pregnancy outcomes, reproductive health care, and bodily autonomy. You may know it as New York's ERA. Thanks to her and many others, as of next month, many New Yorkers will receive 20 hours of paid prenatal leave to access health care related to pregnancy. And that includes IVF care, abortion care, and miscarriage care. With special thanks to New York State Women's Affairs Director Emily Cater and the Governor's New York City Office Director Debbie Lewis, I am proud to share with you a message from New York State Governor Kathy Hochul.
I'm honored to address the CUNY School of Public Health Sexual and Reproductive Justice Hub, which has brought together the leading experts in the field to address how to protect reproductive rights, health, and justice in the shadow of the unprecedented challenges we expect in the months and years ahead. I'd like to acknowledge Senior Associate Dean Terry McGovern and Associate Dean Lynn Roberts for their pioneering leadership in the reproductive justice movement and for establishing the SRJ Hub. Now, as New York's first woman governor, this fight is deeply personal to me. I am committed to preserving access to reproductive health care across our state, and we will ensure New York continues to be a safe harbor for anyone seeking care. Last month, New Yorkers overwhelmingly voted to enshrine abortion rights in our state constitution. This is just our latest action to preserve abortion access after the Dobbs decision. We've already allocated $35 million to reproductive health care providers, mandated insurance coverage for abortion without cost sharing, and enacted shield laws to protect our providers and our patients. My commitment to reproductive justice also drives our work to end the maternal mortality crisis. And I'm so proud that starting January 1st, New York will be the first state in the nation to offer employees 20 hours of paid leave for prenatal care, because no pregnant woman should have to choose between a checkup and a paycheck. I know the Sexual and Reproductive Justice Hub at CUNY will be a vital partner in our state's mission to safeguard these crucial rights. Thank you all for being here tonight.
Hello, everybody. Welcome. Yeah, so glad you're all here. Let me just arrange myself. There you go. Just got to get organized. I am so honored to be here tonight, introducing and moderating this panel. I am thrilled that CUNY is dedicating so many resources and so much of its best people to the idea of sexual and reproductive health. And I'm so thrilled to be a supporter of the Billy Avery endowed professorship. I can't think of a single human being on this earth more deserving than Billy Avery of being acknowledged with an endowment. So I am going to lead us through a discussion of where do we go from here? I don't know about you, but that's what I wake up screaming in the middle of the night. So I couldn't be more delighted to welcome our panel. So let me just introduce them one at a time. Here we go. And I apologize for reading. Regina Davis-Moss. Regina is the president and CEO of In Our Own Voice, National Black Women's Reproductive Justice Agenda, and the In Our Own Voice Action Fund. Working at the intersection of public health, media, and culture change, Dr. Regina Davis-Moss has dedicated her entire life and career to fighting for one goal: empowering women and adolescent girls to make healthy decisions about the urgent challenges facing them every day. Regina is a health equity, sexuality, and reproductive health expert who uses her nonprofit, private sector, and political experience to make communities places that welcome and support everyone. You want me to read the rest of that? There's a whole other paragraph. And so, but I've been given permission to move on. Dezan Dixon Diallo will be here. She's having transportation issues. So I'm going to tell you about her, and then let's welcome her with some kind of crazy standing ovation or something when she gets here. She'll be so confused. Dezan Dixon Diallo is a recognized visionary advocate in the struggle for human rights through sexual and reproductive health, rights, and justice, and the fight against HIV, STIs, and gender-based violence. Dezan is a founder and president of Sister Love, Inc., the first sexual and reproductive justice organization focused on women and HIV in the southeastern United States. She is a founding member of Sister Song Reproductive Justice Collective and a proud member of In Our Own Voice, National Black Women's Reproductive Justice Agenda Partnership, where she advocates for sexual and reproductive health rights and justice in public health and prevention policies and programs. She's the creator and convener of the Women Now Institute for Sexual and Reproductive Health Rights and Justice for Girls and Women of African Descent worldwide, and she has achieved a deep reach with diverse community of listeners for 30 years on her weekly radio program focused on Black women called Sisters Time Women Speak in Atlanta. Terry McGovern is my friend of 30, maybe more than 30 years, the Senior Associate Dean of Academic and Student Affairs at the CUNY Graduate School of Public Health and Health Policy. Before joining CUNY School of Public Health, Terry McGovern was the Harriet and Robert H. Heilbrunn Professor and Chair of the Heilbrunn Department of Population and Family Health at the Columbia University Mailman School of Public Health. That's like a mouthful. Prior to joining Columbia in 2002, McGovern served as Senior Program Officer in the Gender Rights and Equality Unit of the Ford Foundation, where she oversaw global and domestic programming relating to HIV, gender, LGBT, and human rights. In 1989, McGovern founded the HIV Law Project, the brilliant HIV Law Project, where she served as Executive Director. While there, she successfully litigated numerous cases against federal, state, and local governments, including SP versus Sullivan, which forced the Social Security Administration to expand HIV-related disability criteria so that women and low-income individuals can qualify for Medicaid and Social Security benefits. In one fell swoop, you doubled the number of HIV cases in New York City. And TNV FDA, which eliminated the 1977 FDA guideline banning women of childbearing age from in early phases of clinical trials. Isabella, where are you, Isabella? Come on up. Or come on down. Isabella Villarreal Zebra is a dedicated reproductive justice and human rights organizer who is volunteering on way too many things. She is a researcher with a deep commitment to advancing equitable access to reproductive health care. Her work lies at the intersections of reproductive justice and public health, where she advocates for policies that respect and uphold bodily autonomy and individual freedoms. She's a first-year MPH student at CUNY School of Public Health and Health Policy. There she serves as the president of the SPH Repro Club and as the social media manager for Sexual and Reproductive Justice Hub. As an abortion storyteller with We Testify and Youth Testify, a project of advocates for youth, Isabella amplifies personal narratives to reduce stigma and promote understanding around abortion access. In addition, she volunteers with the New York Abortion Access Fund and the DC Abortion Access Fund, which recently became much more important than they used to be, where she supports individuals in overcoming financial and logistical barriers to accessing care. So welcome, everybody. So Regina, we're going to start with you. And we're hoping you can talk about this from the national place. Where do we go from here? Where are we at right now? Tell us where we are and talk to us about how you see it going for the next few years.
Okay, well, you may recall we had an election not too long ago, right? And, you know, a lot of us, I believe, are finally coming up for air. While the election results are disappointing, depending on where you land, I'm going to make some assumptions here. One thing that remains clear is that American people want access to sexual and reproductive health services. 7 out of 10 abortion right ballots passed this cycle. This was across blue, purple, red states, which will expand access for more than 11 million people of reproductive age. And this is according to the National Partnership for Women and Families data. In Florida, 57% of voters supported a ballot initiative affirming abortion as a right. So you may know that Florida, you had to reach 60%. But by and large, that still tells you that abortion is not only popular, but it's a bipartisan issue. So what I want to say is that anyone that thinks they have answers about how the majority of Americans feel based on the outcome of the election is mistaken, right? There's a lot that we're reckoning with. We saw split ticket voting. We saw less turnout for President-elect Trump than we did in previous elections, same thing for Clinton. And we saw that sexism and racism, in particular, anti-Blackness, is not exclusive to white people. And we have to name that. There were many factors that contributed to this outcome. And one thing I could say is that more than one thing can exist at the same time. Now, what I like to say is that Trump didn't win because voters agreed with him on abortion. He won because voters didn't believe that he was actually going to restrict it. You know, he made this promise. And despite this, his advisors, his kitchen cabinet are still pushing for him to restrict abortion on the federal level through methods that won't require Congress to pass new legislation. Even though they have the trifecta, they really don't even, he doesn't have to do that. So what are some ways that he could do that? They can misuse the Comstock Act to restrict access to medication abortion or attempt to ban abortion nationwide. So, for some of you may know that medication abortion is the most common method used in pregnancies, and so they can do this by blocking shipments. For those who don't know, Comstock Act is a pretty old, archaic
19th century. Yeah.
19th century, and was largely used as a time when we had different thoughts about what was considered pornography or profanity, and so they are going to interpret this to be anything that's transported through the mail as vulgar, right? So they could say that if you distribute abortion pills, or medical equipment such as that is used in procedures such as dilators or catheters that doctors use to perform these or hospitals use to perform these procedures, like they could be face criminalization for receiving or shipping that. So you can see how that could really slow things down. He can even do things with regard to the FDA, ask them to severely restrict access by either, saying it has to be dispensed in person. We have to do things like eliminating access to the pill through telehealth, or just actually taking it off the market entirely. And also push back on other legislation like defunding Planned Parenthood, creating abortion bans through other ways like minimizing national standards, minimum national standards, which would attack abortions later in pregnancy, defunding Title X, attempting to repeal the Affordable Care Act. So there's a lot to get into, but I would just end, because I know I'm limited to 6 minutes, but I would end by saying that by a 2-to-1 margin, voters support that we should protect rights, not only to the individuals, but also to doctors, hospitals. Like, we don't want to see hospitals denying care to people when they need it. We don't want people getting punished because they're seeking the care. We don't want to cause disruptions in systems. And so that's the work we're doing at In Our Own Voice in the national level. Dazon, who is our state partner, are there our boots on the ground. We're 12 partners. We have 12 partner organizations across 11 states, and I'm looking forward to talking to you more about that.
Yeah. Thank you. Terry, how about the legal landscape and especially the Supreme Court? Tell us about that.
Thank you. Thank you. Forgive me, but I have to read a little bit. It was quite a task to actually look at what could happen. First of all, I want to say Happy Human Rights Day. We believe that every human is born with innate dignity and rights, and we are not backing down from that. So I'm going to run through some very upsetting things with the caveat that we're going to fight every single one of them. So there is a case pending that challenges the ACA requirement that insurance companies cover preventive services at no cost. The Biden administration had defended it. Project 2025 calls for new requirements for contraceptives and other women's preventive services. This lawsuit was brought by Christian-owned businesses and 6 individuals in Texas, saying that this is unconstitutional, and they are attacking actually the requirement to cover PrEP medication for HIV. It is very complicated. They're saying that it violates the Administrative Procedure Act. The Supreme Court is unlikely to take the case, and the Trump administration is happy with the ruling. The DACA program we know is at issue, but the Biden administration had issued regulations to extend eligibility for marketplace coverage to DACA recipients. There was a group of states, it's usually the same states, filed a lawsuit saying that this violated the Administrative Procedure Act. The new administration is unlikely to take a position on this, and this will eliminate coverage for 100,000 uninsured DACA recipients. You talked about medication abortion. There, of course, was this case challenging, as Regina described, and also invoking the Comstock Act. The Supreme Court sent it back on procedural grounds. The doctors lack standing, but the case continues, and a bunch of states have joined it. The Project 2025 is very clear in its opposition, et cetera, et cetera. So we don't know what's going to happen there. We already have several states that restrict or limit access to abortion pills. In December of 21, Texas made it a felony for anyone to mail or provide a pregnant person with abortion pills if more than 7 weeks pregnant. So that's something that's really important to all of us. Then there is the Emergency Medical Treatment and Labor Act, EMTALA, and emergency abortion care. So shortly after SCOTUS overturned Roe, Biden administration issued guidance saying that the enforcement of this law requires hospitals to provide stabilizing treatment to patients, even if there is a law in the state restricting access to abortion in emergency situations, right? The guidance made it very clear that hospitals and physicians have to preserve the health of a pregnant person, not only in situations where abortion is necessary to save a patient's life. 6 states have no health exception to their state abortion ban. The Biden administration sued the state of Idaho to block the state's enforcement of, a conflict with EMTALA. Basically, this then reached the Supreme Court. Many of us signed amicus about this. The Supreme Court dismissed the case on procedural grounds, and it went back to the lower court. The Biden administration asked the Supreme Court to review this issue. The court declined. President-elect Trump says he believes in exceptions for the life of the mother, but has not weighed in on this. Project 2025 calls for the reversal of this guidance. Obviously, this puts pregnant people at risk in states that ban and restrict abortion, and we're reading all about what is happening, miscarriage, pre-labor rupture of membranes, early pregnancy loss, placental abruption. Women are being sent from provider to provider. Doctors are scared to death that they'll lose their licenses. At what point is it an emergency enough that I won't lose my license? Dobbs opened the door to this mess. So this is a really important space to watch. Also, HIPAA, Biden administration regulation, basically said reproductive health is very, very important. Privacy of your information is very important. And they put out a rule basically saying that providers' health plans cannot disclose abortion, contraception counseling to a law enforcement agency seeking to investigate or impose legal liability. No surprise, the state of Texas has challenged these rules, again challenging HIPAA, the state says that HHS went beyond its authority. So this is something that the new administration could rescind. The next is the Pregnancy Workers Fairness Act. There's a final rule that says that covers abortion-related health problems. That is likely to be rescinded because there's several lawsuits. The next, as Regina mentioned, is Title 10. We saw a domestic gag rule under the first administration. We saw that how it tore apart fragile health networks, how it really destroyed, years and years of progress on reducing all kinds of things. And so there's that picture, but now we have states that have banned abortion, which adds a whole new layer to this problem. And several states that ban abortion are challenging the counseling and referral provisions of Title 10. We'll see a lot of litigation in this whole area. And unfortunately, we had the Chevron case where basically the historic, law that courts had to give deference to agencies, to federal agencies based in science and evidence, that no longer is the law of the country. So the Chevron deference is gone. So this is going to further complicate this picture. And just another part of the Title 10 stuff is a provision requiring confidentiality for minors is at risk because there's a lawsuit by 10 states requiring parental consent to get contraception. Um, anyway, we'll also see the global gag rule come back. You all know that this also was tremendously destructive in the world, obviously in the news a lot. The Trump administration does not support does not actually supports the Tennessee law prohibiting gender affirming care services for minors. It does appear to be open season on transgender individuals. This includes non-discrimination protections that exist. The Biden administration, interpreted them to cover transgender people, and it's very clear that this administration does not see it that way. Same with gender dysphoria disability protections. We can expect some bad things there. I will say that, and I won't go into this because, again, I want to return to the more hopeful messages, which will come back around. But I think we need to think about when we're reading all this stuff about HHS, the vaccine. So the HPV vaccine is a vaccine. So what we're reading about has profound implications for public health generally, but what we're talking about today, similarly, when you talk about we're going to reduce the number of institutes at the NIH, you can bet that the institutes that focus on minority health, the institutes that focus on women, we already had a lot of questions about the failure to invest in complicated research that would tell us more about environmental exposures and maternal mortality, that look at aggregate exposures. So watch this space. And the last thing I'll say is obviously all the stuff going on around schools, the Department of Education, et cetera, et cetera. Having read through this even edited list of things that can happen, I just want to say again that we are going to hear from Isabella, who will give us all hope. But I think I do think that we sit here at CUNY School of Public Health very proudly, led by our dean, standing up for science and evidence and justice and human rights. So they may be bringing it on, but we're gonna fight the whole way. So
Good news. Good news. And no pressure, Isabella. But tell us about what youth advocacy is looking like, what it looks like from inside of higher education. Tell us about your perspective.
Yeah, so hopefully I can bring some hope. So I'm from thinking, and I'm gonna start thinking on New York City advocacy and organizations that have been since Dobbs. We have definitely seen, as most people know, an increase in like abortion patients coming to the city, abortion care, abortion costs, and when, for example, when we had the last election, I was on shift for the New York Abortion Access Fund. And while we were receiving news of the election results that Trump was elected, I was like, okay, I need to answer calls. I need to make calls for patients and still help them. And that, along with messages from orgs that I'm part of or I'm friends with, gave me a lot of hope in thinking people are going to still be needing all this reproductive health care after, regardless of who is in power, regardless of the election. As we see in Ben states, people are still having abortions, and people are going to still have abortions, gender affirming care, all this kinds of reproductive health care, regardless of who is in power. And that gave me, actually, it could have been mishope, but it gave me a lot of hope in thinking that the community so far, the reproductive justice community, the bigger community, has brought us this far. They are here, and the community has never been about politicians. It has never been about elections. It has been always about the people and like who we can help, who is here, who forms us. And I think that in that there is so much power, and the community is just going to get stronger. I've seen different people in different communities just getting stronger since the election and reminding ourselves that that's what we are about helping people, about being here for each other. And in that, including now youth advocacy, I've seen young people taking the lead, which has been something amazing to see. Myself, including in young people, I'm 24 still, so I'm still considering myself young. And including seeing like people, okay, we had the election. Of course, some people took the time to like rest, to mourn the results, whatever they perceive the results as. But people are starting to take action. So here we have, for example, the Reaper Club. We're like, what can we do now? So we're thinking of like, for example, just easy thing, like remembering the joy of activism, remembering the pleasure that should be involved and when you're in community, when you're doing reproductive justice work. And so, for example, oh, we're planning a January gathering as if nothing is happening. And it's not to pretend it's not there, but it's just to remember that we're going to be here either way. And we're not going to go away. It's not going to, like, we're going to adapt as we always had. And I'm new-ish to the movement. I've been doing this work for 5 years, but we've seen like people on this panel that have been doing this work for so long and like how they've adapted, and we can continue to adapt. We will continue to adapt to whatever happens. And thinking more, for example, in higher education, this is something I'm very excited about. I've actually been already wondering if I can transfer into it. There is going to be a new concentration here at CUNY SPH soon, probably in a year or so. We're in the works on sexual and reproductive justice, and I'm very excited about it. Like I'm already, can I transfer? I was asking that today. Can I like still get that one? And that is coming. We have the Billy Avery professorship, which I'm so excited about. Like I've never seen, to be honest, Billy Avery talking in person. It's a goal. Hopefully, I will at some point. I've seen videos, and they're all amazing. So I'm very excited. And it's just, I think my message of hope is that the community will still be here. We'll still be here. We'll be fighting. Young people have been starting to take the lead, which is amazing to see. And I think we're in good hands. From what I see, I think we're going in a good direction, and I'm excited to see what new creative ways.
We're in feisty hands. Anyway, did I just see Dezan walk in? Dezan, welcome on to the panel. Come aboard. Welcome. Your timing could not be better.
Yeah.
I'm glad you said it. Don't feel it. But
But yeah, that's I guess my message of hope, and I hope
Thanks.
I gave hope.
Thank you. And thank you, Isabella. And Dezan, we were just asking everybody about what it looks like from where they are. And you are in Georgia, a banned state. So maybe you should just tell us about the situation on the ground in a banned state, Georgia.
you say bad state or ban? I know. I'm just
Both.
Hey, everybody. I flew all the way from South Africa for this. So, and that is not why I was late. Welcome to New York. So thank you all. And I'm so grateful to be here. And Georgia, right? We're unique. We're in the Deep South. And I always start out with the fact that the Deep South is way more than a geographic distinction. And that's what we're experiencing in the midst of this, what I would consider a reproductive justice crisis. And it's not just because of and I learned a lot about Dobbs, who's actually a good guy. So it's really hard to continue talking about the case in that person's name who forever will be stained by that Supreme Court decision. But it's not just about that. It's really about where we are and where we've been with access to healthcare in general in the state of Georgia, where we've been since 2019 dealing with the 6-week abortion ban in the state of Georgia, but also where we are with the lack of consistent information, the lack of consistency in terms of policy and policy changes, what happens, our legislature meets every year, but it's 40 days. And a lot of stuff happens in those 40 days. And so where we are right now is we're in a state that just before the election, we were dealing with a combination of mourning, grieving, outrage, disappointment, but also resolve because of the deaths of Amber Thurman and Candy Miller. Those two reported deaths from the commission jolted us in a different way, even as we were looking down the barrel of the reinstatement of the 6-week ban, right, which had been under injunction since 2019 because of the lawsuit that was brought by Feminist Women's Health Center, Sister Song, and other members of our coalition. But we have a pretty big and robust coalition that's been working through the election on the ground in education, but also bringing to light, which I think is also probably this future conversation. What's happening on the ground is we're having a different conversation about maternal health. And that for the first time, abortion is a part of the maternal health conversation in ways that it had not been before. And what that means for us, and just the sliverest of hope, if you will, is that there are lots of areas where talking about maternal health and well-being gets bipartisan support in our state legislature. We've managed to do things around maternal health and mental well-being, which means when we can deal with abortion trauma, for example, in the wake of the bans, not because of the abortion services, but because of the bans, then we have some conversations. I'm not going to say movement yet, but conversations that are happening. But I think that there's a couple of other things that are super important that's happening on the ground. We had, prior to the reinstatement of the bans just before the election, we had 6 local women's services or abortion clinics. 1 has closed. 2 are on the brink. Our only nonprofit organization, Feminist Women's Health Center, brilliantly, because Kwajalein Jackson is amazing, has diversified a lot of their work and a lot of their services so that they are surviving, but they're barely surviving. And so we have a diminishment of services that aren't necessarily only abortion services, but are the places where people were relying on. If you know, when the leak came out, right, prior to the Supreme Court decision in June of 22, when the leak came out, Planned Parenthood Southeast Georgia stopped doing abortions before the decision was even made. So we've had hundreds and hundreds and hundreds more women having to travel outside the state, take risks like Amber Thurman did, and come back with lots more questions. We also have on the ground, I think, a really robust body of young people who are angry enough to organize. And so there's a lot of organizing going on. We saw it specifically during the election. And now we're just trying to figure out how to keep that energy going, how to keep them hopeful and still angry, but also focusing in on themselves a little bit, because this is the other thing. We've got a lot of people who are still demoralized, despondent after this election, all the hard work that went in, the sense of betrayal, if you will. And at the same time, understanding, and it's not about resilience, it's about resistance and it's about resolve. And so we're taking, just like everybody else, there's a little bit of a break, but I even just got word today from our Repro Action group that, we're ready to start talking about what we're doing for the next 5 to 10 years. So that's a bit of what's going on with us in the state of Georgia, while we're still fighting, for example, to expand the Affordable Care Act, to expand Medicaid, to make sure, for example, now that we can get better contraceptive care, better comprehensive sexual health education, better access to preventive services that we didn't have before, because there's a new impetus for that. We are also we're very, very much focused in on expanding what the intersections need to look like in terms of the reproductive justice work that we do. So there's a lot more work that's happening across, for example, with trans health, the trans youth experiences, those things that are also simultaneously under attack in our Georgia state legislature, as well as in our schools and in our communities, very much in the same way that all sexually active teenagers are being discriminated against in that regard. And I will say that alongside that, finally, there has now been a nexus for us between sexual health and reproductive health that had not been there before. So there's a larger movement, for example, in the HIV movement, the HIV community in the city of Atlanta anyway. There's a lot more convergence around what access to sexual and reproductive health looks like for more populations than those who could become pregnant. And so those are some of the real things that are happening. And it is not all bad, but it is definitely all hard. And that I think is the reality that we're in right now and the stresses that we're under.
Right, right. Thank you. Um, yeah, there's a great novel called Bend Down So Long Looks Like Up to Me. And I think the gravity of the situation is almost a bit of a gift in the sense that, you know, in 2016, we all got out there with our pink pussy hats, and that wasn't a strategy. And you know, it contributed to a lot of exhaustion, disillusionment, and lost hopes. So what we need now are strategies, real, viable human strategies. So Regina, I'm going to start with you. What are you thinking in terms of strategy going forward?
Well, so in addition to the obvious federal impact, of the upcoming new administration will certainly have serious like repercussions across the states and at the local level. So what we're planning to do at In Our Own Voice, not that we had not already been doing this with our partners, is really turn to the states, at least for the next 2 years and maybe 4. Um, there's a trifecta. That doesn't mean we're not going to still be bold and still try to um, ensure that we're messaging on like why this is an opportunity to finally get what we've been asking for 30 years, right? I mean, it's already been, we're at ground zero, so we might as well not try to restore status quo or try to get something that didn't work for us from the beginning. That being said, there are some issues like Desan's already said, things like maternal mortality or the economy that are, you know, bipartisan that we'll be able to at least have conversations on. But primarily, we're going to be turning to the states. And so, you know, in recent decades, reproductive justice has been under attack through state legislatures, and governors' mansions. The majority of our nation's states' houses are controlled by far-right conservative politicians, and many of whom were elected on mandates to roll back reproductive justice. And so the impact on Black communities has been particularly hard. The majority of Black women, girls, and gender expansive people live in these states where they're like especially dire, and a lot of those are in the South, as Desan talked about. So slowly but surely, they've been chipping away, and these states have been enacting these bans. They have been doing this in spite of the ridiculously high maternal mortality rate, all of the things that has been discussed. You know, they're trying to restrict our voting rights. They are doing everything they can. And at the same time that these conservatives are doing this, they do not make up and they do not reflect the communities that they're representing or you know, claim to live in. And so really what we need to do is our strategy needs to be, we are becoming more educated, we are turning out, and it's difficult to say, particularly for Black women, we need to turn out, because like 92, we've turned out 92%. And I mean, I don't know what more we could have done there, but we need to be making sure that we are turning out, doing the education, we are the strategies to protect human rights and realize reproductive justice are going to require these deep state-based policy and advocacy strategies that are going to be long-term. You know, they took a long time to get these judicial appointments so that when the time came, they were going to be ready to enact this. And so that's the strategy that we need to take. So a lot of the work we're going to be doing in partnership with our state and local partners is issue education, polling, voter-centered work. So we have an I'm a Reproductive Justice voter initiative, really trying to shift state houses over the next 20 years so that we have the representation. We need to shore up reproductive justice support in progressive states. That is where we're going to be able to show policies that we need to enact, normalize them, because it's not going to happen in the states where it's difficult. We're going to be continuing training storytellers. These are the people that go into their offices, whether that's on the Hill or in their districts, and the elected officials have to listen to them. People are afraid to go in there, but that's their job. So we're going to equip them so they can tell the stories and be compelling, discuss the importance of key policies beyond abortion, beyond abortion, beyond abortion. There are so many issues that we have been saying impact our reproductive decision making and can be conversations for why we likely didn't get the turnout that we thought, why it was not the winning election issue that we thought. And so we have the opportunity to have those expanded conversations like childcare, minimum wage, affordable housing.
Can I ask you a question, just push you a little past
Uh-huh.
that? Was it that people didn't think it was important or that they believed what the Republicans had to say about not looking for the federal ban?
I mean, so remember I said it's a multi-layer issue. I want to, there's a conversation about the economy, right? And so when people say it was just the economy, I remember I said 92% of Black women turned out. Who feels the impact of the economy more than Black women? So to say that that is why people voted based on the economy, then why did 92% of Black women still vote the way they did? So it's not just that. I think in some cases it was willful ignorance. People wanted a reason to vote the way they wanted to vote. And so it gave them that reason. But, you know, we have been conducting polling for the past 10 years. And when we ask both at the national and the state level, Black women and male voters to vote their top issues, abortion is not the number one. It's the economy, it's racial justice, it's free and fair democracy. Certainly top 5 because we're disproportionately impacted in terms of criminalization and the maternal mortality, but there are other issues. And so we have to figure out a way to speak to those issues and center those communities so that we're compelled to turn out. I mean, Black men said, we would talk to folks, you know, I mean, I'm pushing back on that myth, but they did have to say things like, you know, I want to be able to start businesses and things like that. And so we have to be able to speak to these communities. I'll just end by saying that, you know, ballot measures are going to be very important. We need to identify core issues there, Project 2025, and just being very focused on not only safeguarding what we have, but also not getting so stuck in defense that we're not ready in 2026.
Yeah, bravo. I mean, 2026 is going to be huge, and getting donors over their exhaustion just as much as the activists. Terry, the court is dire, and it's not just the top court, it's all the way down the line. So what are the legal strategies? And I'm interested to know where you think we're going with contraception as a person who's just spent the last 8 years investing in a company that's trying to pick the pill over the counter that the FDA for 8 years now has said no to.
So, I mean, first I want to call out the importance of reproductive justice as the framework and the incredible leadership of Black women really many, many, many years ago, saying it is entirely outrageous to sever abortion from maternal health, from maternal mortality. And I always say it, but I will never recover from the state of Mississippi not being challenged in that Dobbs argument on its record of maternal and child death, the 108 outstanding abuses in the foster care system, all kids of color. So, we have a lot of work to do. We, white women, have a lot of work to do around, listening to the leadership that has been all along saying, you're leading us down a very dangerous path. So to me, a strategy, it's amazing that we sit here at CUNY School of Public Health and our dean is leading us in this reproductive justice concentration where we're actually going to talk about these issues. We're going to talk about not just the infiltration of policy processes like land use decision making, which I'm going to come back to, but also what do you do when you graduate with this degree and you're in an environment where science and evidence is meaningless and racism and misogyny is rampant? Like, we are going to seriously take on these issues that we don't adequately prepare our students for what they're being released into. In addition, enough with the disparities, right? We need the kind of data that gives us the ability to develop interventions that will work. So I have to say this piece about the next generation and training people in a reproductive justice framework that actively addresses racism and misogyny and the anti-science environment that we're in is a really, really important thing to do. So that's one thing. Secondly, obviously the courts, it's hit or miss now, right? Who's the judge? So I think it's really, really important as we do our community work to do that transformative teaching that shows you that person X, Halliburton loophole, fracking is exempted from federal regulation because Dick Cheney was in office. And I'm sorry, that's an obvious example, but there's a million examples like that. And somehow this new administration has convinced the public that they represent the interests, the economic interests of the little people, right? And it couldn't be further from the truth, right? So we have to widen our lens on community organizing beyond, obviously taking the reproductive justice framework where everything is connected and economic opportunity and who the judge is relates to all of this corporate stuff, right? So I think that much more than I've ever seen in my lifetime, activists on the ground are doing that. So in some instances, litigation, we can use state constitutions, you see it all over the place. You also see that many of these, referenda are being successful. So I do think that, we have to do a lot more strategy, very intentional strategy. And I think I see it happening all over the place. I also as you well know, I came up when Reagan refused to invest in HIV research. In my lifetime, I saw activists destroy long-term patents to save people's lives, right? We have seen the impossible happen. And,
Thank you for that, Terry. That's
and so nobody's giving up here, right? Absolutely not. I think we have to change how we do our business.
right.
So
Right. Thank you for reminding us of that. Because yes, those of us old enough remember people putting literally their bodies on the line to change policy at the highest levels, even with the most unfriendly, inhospitable regime in charge. And so that comes to you, Isabella. So where is everybody? Where's the energy? What do you see as it looking like going forward? Are we talking about bodies on the line? Are we talking about civil disobedience? Are we talking about where is it going to happen, and what do you see going forward? And frankly, for me, I think fear is a big issue. And are you encountering it out there at all?
Okay, so I think there are two main things that I think. First it was something that I'm from Brazil, and whenever I go home, it's always getting so much more energy from activists in Latin America than the contact I have here. And that is a point that I think there's a lot we can learn from other movements. And there's a lot we can learn from how, for example, Latin American feminist movements have been abortion rights movements, but other movements in Latin America have been. So I think there's a lot we can learn. And I think that in those cases, in most of those cases, they have always been fighting a government that has never stood with them. So that is also something we can learn, like to keep, because they've always kept going. They've always been here. And so like to keep being here again, independently of who is in power, we're gonna still be here. And the second thing I keep thinking is again, this idea of how youth are becoming more and more part of the movement. It was something I was recently in contact with a lot of friends from the reproductive justice movement, and we were talking on how sometimes it is hard to enter the reproductive justice movement when you're a young person. It sometimes can be, you don't have, of course, you don't have that much knowledge. You are not going to have as much experience as people ahead, but I think the movement has been opening up more. At least I feel that. I've been welcomed in more and more spaces. And I think that's one of the paths forward is welcoming more young people. Is like, it's all about meeting people where they are, not expecting them to have some kind of knowledge, some kind of experience, and actually being open, like arms open. And like, how can we welcome people? How can we welcome young people into the movement? And how can we actually now start giving leadership to these young people? How can we see them thriving? Because as Dean got Terry, okay. So I got as Terry was saying, like once you graduate, there is so much. It's, for example, finding a job, for example, in reproductive justice is such a hard work, especially when you're a young person. Like most, even in still in reproductive justice, a lot of, for example, jobs are going to say, oh, you need at least like 5 years of experience in this. And one of the things we're facing is like, how am I going to have this experience if there are no positions open for people to get that experience? So I've seen more. I work a lot with like advocates for youth, so I've seen a lot of like young people actually taking the leadership and like starting in roles. And I have friends, for example, that right after college started working in big organizations that like Planned Parenthood, Federation of America. And like, so it is a lot about believing in the youth. And I think that's a big part of where the energy we were saying, how to keep young people like the energy, how to keep that angriness is a lot about actually valuing young people and what they have to say. There are a lot of ideas that come from like every time I talk to even people younger than me that are in the movement already, like talking to them is like, you always leave with something new. And I think that's the kind of thing we have to keep our minds open to always leave with something new. And how can we apply those new things to this moment that is not going to be completely new, because there has been a Trump administration in the past, but has now as the trifecta and has
Yeah.
again so much at stake. We've already had Dobbs, so like it isn't going to be
It
a
is
new
new.
moment. It is new.
Yeah. It is.
So how are we gonna, I think again, yeah, making strategies because things are gonna be different. So how
Yeah.
can we be different with it?
Yeah, and it's really important for people who run organizations to remember that sometimes the lack of experience is a benefit, not a liability. Because look at where we are, and we need some fresh thinking. Dazon, I am someone who hemorrhaged at 20 weeks with a placental abruption. And I often try to imagine walking into the hospital, into the emergency room, and having a doctor be not certain of whether to treat me, much less how. And it gets me very emotional just thinking about it. Uncertainty is always like one of the first tools in the authoritarian handbook, right? Because it's really more about that doctor's uncertainty than it is about whether I live or die. And there's a lot of, I think already, I'm seeing it in the foundation world, a lot of anticipatory or anticipatory conciliation. I'm seeing it all over the place. So tell me about how you see it happening in Georgia. Are you seeing that anticipatory conciliation? And how are you going to strengthen the backbones of the all-important healthcare profession?
So I want to take us back to that same story, Amber Thurman, for example. I'm not yet convinced that it was only uncertainty. This is a hospital that was on the south side of town in a rural county. I'm not yet convinced that there weren't, just like now we know the Klan is everywhere. The Klan is in our clinics, the Klan is in our firehouses, the Klan is in our police departments, the Klan, they may have a new look, they may have a new name, they may have a new robe, they may have a new hood, but they're there. And they could also be the hospital administrators who sat for 20 hours. Yeah. Okay, so I'm not necessarily convinced that uncertainty is the only aspect of some of these delays in decision making. But there are a couple of other things, and I got a few more things to say in terms of how that approach is working in terms of where we're heading. We have I'm gonna just say it out here, just learned. Our governor, who is up for he's probably gonna run for Senate if he doesn't run for president in the next terms. His family, though they changed their names, his family brought slaves to Georgia, introduced slavery into Georgia. So this is how deep and far, when we talk about these intersections between race and gender, and now also class, because of the deep pockets and the money that exists, that some of these decisions are driven by history. Some of these decisions are driven by the cultural context, the social context, where we are in the Deep South. And so there are a few things that I think about in terms of where we are and what we're strategizing. One for us is that we still don't have, speaking from an economic standpoint, for example, whether it's for the hospital, whether it's for clinics, whether it's for organizations like mine. And by the way, thank you. I was barely like 1 month into being 18 when I first started working in this work. 24 when I started Sister Love. So young people, I feel you, and I know that there's amazing opportunity, potential, and power within your own movement, ideas, in terms of your own vision, in terms of your own praxis. And my organization is one of those that we ain't scared. We love hiring folks who are new in the work, who are new out of school, who are trying to get that experience, but also bringing us the energy that we need. And we're all right to be that stepping stone sometimes. Now, we're not happy with this rapid turnover in the current workforce that we're living with, but we still have a deep respect for where we know that young people coming into our organization are going to take the work. I also want to remind us that reproductive justice is everything, but at the same time, it's not necessarily the capsulation of services. That's still reproductive health. So that's one point. You got the rights, the law, and the policy work that still has to happen, which is the rights work. And then the justice work is that movement building towards dignity and equity and bodily autonomy. And you can't have one without the other, similar to the human rights framework. And so in that regard, we're continuing to work at that intersection of where those things live. And let me give you an example. We do policy and advocacy. In Our Own Voice knows this because they're supportive of us. We're in this partnership. So we do the mobilization, we do the civic education, we do the voter education and mobilization and getting people to the polls and understanding their votes. But they don't always understand their own rights, right? And there's also not a lot of legal representation and legal activity happening in our region by us in our region. So one of our strategies going forward is to shift, because everybody's doing the same thing we do. A lot of them are doing it better than we can, right? And so why don't we continue to support and engage in those things? But where we're moving is into doing more legal work and law and policy work. In other words, teaching people their rights and them being there to represent. So we're building that now, because that, I think, is a part of the future that we don't have in my region. Another piece that I think is important is you talked about the referenda. I'm in one of those states where until we change the entire legislature, that's not even a thought. To get a ballot initiative in the state of Georgia, you don't need signatures by people. You need 2/3 of both houses to agree to put an initiative on. And when you're in a legislature that is a supermajority of Republican and quickly growing MAGA, right? That's not a hopeful strategy for us. Bringing in these issues as electoral issues, as bread and butter issues, as kitchen table issues, in terms of all the intersections that have already been spoken about, in terms of understanding, we don't still have, for example, real data on the economic impact of not providing broader, more comprehensive approaches to sexual and reproductive health. What does it mean to not have continued access? What is the economic cost of losing these clinics? What's the economic benefit of making sure that people have bodily autonomy and access to choice and planning their families and working in their communities? I'm with you at, we have one of our funders actually is a disaster relief kind of agency. So we have access to their warehouses, and we have just put in an order for the oat pill so we can give it out like candy, right? So these are the things at the real grassroots level of engaging, not only meeting community where they are, but meeting them where they want to be met. And in order to do that, you got to ask and you got to listen, and then you have to respond to what's been said. And a part of that includes now really going after these crisis pregnancy centers, these fake abortion clinics that are digging heels in deeper by expanding their work to do HIV testing. They're doing STI screening.
Is there not like a business attorney who can bring fraud cases? I mean, why do
When
we
you
just
have 89 of these facilities in one state, and they have a budget line item in the state budget, a state budget that has given no money directly other than Medicaid support and federal dollars into anything in terms of prevention, right? Where they're getting literally at least $2 million every year to continue their fake work. So that's why we have a mobile clinic. I can't wait to get my ultrasound machine and my incinerator toilet. But we now have a mobile clinic that are part of our strategy is to track, trace, and control them. I'm also the only mobile clinic with a PA system. So we can roll up and be an alternative in real time in the real community where folks are getting these other services. Because the other thing they do is provide services that people need, even if they make them feel bad while they're trying to access those things. So why aren't we doing more of that? And then the final piece on this is that if we don't get our handle on building global solidarity around reproductive justice, then we're going to continue to be out here on our own. And it's not just about accessing abortion where it's not accessible or legal, or it's not just about understanding the intersections of reproductive justice in the context of fighting for something we can't have. In South Africa, where I am, abortion is legal, abortion is free. But a young person can't access it because of attitudes in providers, because of lack of information when they show up, or because they don't have appropriate regulation of these services that they're showing up in really dangerous places where they can actually afford abortions that aren't really safe. And so there's a much larger conversation about what reproductive justice looks like in the global context that we still need to have these conversations, but also find the common ground where the issues are common, the issues are the same, the experiences are the same, and then come up with a couple of those workable strategies that we all are putting into place that are working in the context of the communities, the cultures, and the social settings that we're in. And you know, the last of my strategies, let me do this.
Uh-oh, I'm scared.
Yes. You want me to stand up? Y'all got your dollars ready? Yeah.
There you go. Yes.
The first and the last of your strategies is to trust the people who brought you reproductive justice.
Yes.
Is to trust the people who, for whom democracy has worked the least and we believe in the most of anybody. Is to trust the people who brought you humanity, doggone it.
Yeah.
So, I mean, there's some strategy in what does that mean? Understanding what does it mean to get your people, but what does it mean to also center Blackness in this whole enterprise of affecting change, right? And it doesn't only start with electing somebody into the White House. We've tried that. It's really about following the leadership of the indigenous expertise and the lived experiences of how Black women move through these things, even when no one is looking, when no one is investing, when no one is funding, and no one is counting. That's where the future strategy and the work has to be, and that's where the change will come.
Beautiful. Now, I know we said something about questions from the audience. Do we have questions from the audience? Okay, great. Thank you. I know we're also running low on time, so we'll try to be quick about it. Question one, this is a long-term battle. How do we get better at how do we get better a collective care to be able to keep this work going? So collective care for the movement. How do we do it over the long term? We need young people, and that's where you guys come into it, because you think in memes and videos, and we need you know how to edit. Nobody has to teach you. We need you guys, and we need as much content from you as you can bring us.
And if I add to it, it is the media part of it, but the other part of that strategy is technology. What role is technology playing in new delivery systems of care, of service delivery, of continuing to engage people in their own health and well-being? We're even developing platforms, AI platforms for engaging people in PrEP, engaging people in contraception, engaging people in staying involved in their own health decision-making, but doing it through their own apps and their own processes. So technology, the alliances are there, and technology is the future of how we're going to continue to build them.
Right. And there needs to be some preventive work in the technology space as well, because there
Ooh,
are period
yes.
tracker apps that we know are getting
right.
hacked. Yeah.
Thanks. One thing, responding to the dean, guess recently, yesterday to be more exact, I was talking to different lawyers in the If When How project, and we were talking about whether, for example, physicians that actually report, because they're like one of the most, like, in a lot of places, they are the ones reporting people that have, for example, had abortions, that they are reporting. And we were talking about how a lot of these physicians don't actually know what happens after they report. They're like, oh, I'm gonna report, did my part, like check, and that's it. So they, for example, they found how, which was something I found amazing. They have been creating workshops. They have been teaching providers what happens when you actually submit a report, what happens when you criminalize something. And I think that kind of like information, that kind of teaching is something really important.
Yeah. Question two, so many foundations are withdrawing from supporting gender justice work. How can we ensure this work is adequately funded so that activists aren't always sacrificing to do this work? I'll tell you, I've spent, most of my adult life in women's funding, and if I knew the answer to that question, I would have been doing it.
I think it's going to have to be consumers. What I mean by that is, there's so much energy around the side hustle thing these days. Community organizations got to have their side hustles. Community organizations have to figure out what their profit offerings are, because people will pay for just about anything nowadays. And I mean that. Whether that's paying for education, paying for information, paying for products, paying for one of the ideas, for example, is while we're over here giving things away for free, we want a subscription service to sexual health packs every month, right? Just have something cool and special delivered. I know this sounds micro, but if we're not thinking in the context of, yes, we still want foundations to be held accountable. Yes, we want them to get up off those dollars and put them where they're needed the most. But the revolution ain't going to be funded, right? And so, what are we engaging in from a venture space that says we know how to raise money, we know how to offer and count the things that we offer, and we know how to measure people's satisfaction in these things because we do evaluation. And that's essentially what profit businesses do. That's essentially what profit making consulting houses and firms do. And that's what we lack in doing because we give everything away. And the funders expect us to keep giving it away while they're not investing in what we have to give. And so that's the other avenue that we have to consider is what we're doing to generate our own, not just annual budgets, but millions of surplus so that we can actually invest in our own change.
Yeah, there's also no ethos of risk in the foundation world at all.
That
And
part.
if you go to the places where there are the most resources, there's also the greatest level of fear and a certain satisfaction around allowing the most vulnerable people to shoulder the greatest risk, and that we really need to talk about that. Any thoughts on how reduced numbers of providers in banned and highly restricted states, such as people leaving the state or not doing residency training there, could lead traditionally non-SRJ supporters to become activated because there aren't enough providers? It's a thought. It's an interesting thought.
I mean, I think that for sure is going to happen. I mean, that what is documented is the physician flight from the areas, right? Because how can you put up with this? So there are very good physicians still holding strong all throughout the country, just to acknowledge that. But yes, I do think, there's an acute healthcare crisis in many parts of the country. So that's a very interesting point.
Great thought. And this is the last question. How do we address the issue of misinformation?
I guess one thing I could say, coming from a country that had a big, big thing on misinformation, especially around elections, um, it's hard because we live in an age of information, but that also means disinformation. And I think it relies on like us actually creating content, actually moving more and trying to showcase the most we can of like actually evidence based, actual like factual knowledge that is happening.
Yeah, I don't understand why people in our world don't do what Steve Bannon has been talking about, which is flooding the zone. Why are we not flooding the zone? The answer to disinformation is more information, not less. Sorry.
Yeah, I would agree. And I think there's a couple of things we have to do. So you've already acknowledged that people are canceling their newspaper subscriptions on all these other things for one reason or another, but also because increasingly they're looked upon as not the traditional news services like they used to be, which were, unbiased reporting. So, as we continue to move more to digital information gathering, we've got to figure out, or not figure out, but find out how the communities we want to reach prefer to use, receive the information, where they're getting that information, and then create the situations for them to receive it. I mean, when you listen or uh, when I think about these certain populations, like the white males that listen to these podcasts, right? They're in a vacuum. Now, they don't believe what they hear is just misinformation and disinformation. They just think this is where I go to get the information that I want to receive, and they don't realize it is being disseminated to them in a very curated way. And I don't know that there's much we can do about that, but what we can do is make sure the communities we want to get information to is getting the accurate information.
Yeah. So, Lynn, I want to hand it over to Dr. Lynn Roberts, Associate Dean of Student Affairs and Alumni Relations, for our final remarks. Dr. Roberts served on the Sister Song Women of Color Reproductive Justice Collective Board, and her current work explores the intersections of race, class, and gender in adolescent dating. I'm so glad I don't have to think about that anymore. Juvenile justice and reproductive health policies. Dr. Roberts.
Thank you. Thank you all. Sorry I had to step out and missed some of the panel, especially by my fellow Emeritus Board Member of Sister Song, Daison Dixon Diallo. I had to step into my course this evening and greet my students. I got the distinct pleasure of just thanking you all for being here. So bear with me because there are a lot of people to thank. So thank you to our moderator and panelists this evening, Abigail, Daison, Isabella, Regina, and Terry. And let's just give them all a round of applause. I also want to take this time to thank the SRJ Hub staff and faculty. I would like to ask all members of the SRJ Hub team to please stand who are in the room, including some of you who are in your seats, some of our faculty. I see some of you, Diana Romero, and let me see who else. If you're a faculty member, yes, please, please stand up. And then I also want to especially thank everyone who was a member of and involved in the event planning for this evening. And that includes Terry McGovern and Shayanda just walked in, Ana Oha, Danielle Green, who's been all around with the mic, Molly Bratton. I hope you heard from Molly. There she is in the back. Isabella Villa Real Sabra. And Nana Day, am I there in the back? I hope I'm apologies if I didn't get that right. I meant to ask you earlier. Sumana Chandra, who I think is on vacation this week. Julie DePriel. It's a long list, bear with me. Catherine Hartley, Deborah Levine, Sapphire Howard, Ira Mamaj, our SPH student and staff volunteers, probably too many to name one by one. All of our IT team, our facilities staff, and our security staff, who all, without all of you, this evening would not have been possible. I would also like to thank Regina's team and especially Donna Morris. Yay, Donna, who brought the mini exhibit here and set it up for us. It's set up here for you all. If you didn't get to check it out already, please, you'll have an opportunity to do so soon. And just to point out, this is part of a small version of a much larger exhibit. Many of us had the pleasure of seeing at the 30th anniversary of Sister Song. I'm sorry, of RJ. And we had a gala last June in Washington, D.C. So you'll have a chance to check that out if you haven't already. And finally, as I conclude this wonderful event, I would like everyone who's able to do so to just stand and linger around the exhibit, grab a mocktail, and because we want to move the chairs in order to make it more of a reception space. So that's really important. So again, thank you all so much for coming. I believe those online are going to leave us now, but we're so glad you were all able to be here for this really necessary conversation that we hope to continue with all of you.